Hello and welcome. Today we're exploring one of the body's most vital yet underappreciated organs, the pancreas. This silent worker toils behind the scenes, performing not one but two absolutely critical jobs that keep us alive and healthy. Think of it as both a master chemist for your digestion and a blood sugar conductor for your entire system. By the end of this video, you'll understand exactly how this amazing organ works, how to keep it healthy, and why it deserves your attention. Let's begin our journey. First, let's locate this incredible organ. Your pancreas is nestled deep in your upper abdomen, right behind your stomach. It's positioned horizontally, almost like a tadpole stretched out behind your stomach. The wider head end sits comfortably in the curve of your small intestine, while the thinner tail end points toward your spleen. Measuring about 6 inches long, roughly the size of your hand, this gland works tirelessly without us ever noticing it. About 98% of its tissue works as your personal digestive expert. This part, called the Exocrine function, produces powerful digestive enzymes to break down your food. Every day, it creates an incredible 1 to 4 liters of pancreatic juice. When food leaves your stomach, this juice flows through a small duct into your intestine. Here, enzymes like amylase, lipase, and proteases deconstruct fats, proteins, and carbohydrates into tiny particles your body can absorb for fuel and repair. What's fascinating is the intelligent precision of this system. Your pancreas doesn't work randomly. It's triggered by specific hormones, like secretin and cholecystokinin, released only when food enters your intestine. For fats and proteins, it releases specific enzymes. Simultaneously, bicarbonate is secreted to neutralize the harsh stomach acid. This is a critical step, as it creates the perfect, non-acidic environment that the digestive enzymes require to do their job effectively. The remaining 2% of your pancreas performs an equally crucial role as your blood sugar conductor. This is its endocrine function. Scattered throughout the organ are tiny islands of cells called islets of Langerhans. These specialized cells produce hormones and release them directly into your bloodstream to circulate throughout the body. The key players are: beta cells produce insulin, which lowers blood sugar after meals. Alpha cells produce glucagon, which raises blood sugar when needed by signaling the liver. And delta cells produce somatostatin, which helps regulate the balance between them, acting like a conductor for this hormonal orchestra. Think of insulin as a key that unlocks your body's cells, allowing glucose to enter from the blood and provide energy. This fuel is vital for everything from muscle movement to brain activity. Without this precise system, glucose would remain trapped in the bloodstream, unable to power your body. Your system couldn't maintain the stable blood sugar levels that all your organs, especially your energy-hungry brain, need to function properly and keep you at your best. Let's start with pancreatitis. This painful condition occurs when digestive enzymes activate prematurely inside the pancreas, causing it to essentially self-digest. This triggers severe inflammation and tissue damage. Pancreatitis can be acute, a sudden, intense attack, or chronic, involving ongoing inflammation that leads to permanent scarring. The most common triggers are gallstones and heavy alcohol use. Key symptoms include severe upper abdominal pain that often radiates to the back, accompanied by nausea, vomiting, and fever. Pancreatic cancer is particularly challenging because its deep location and vague early symptoms mean it's often detected at advanced stages. Warning signs like jaundice, unexplained weight loss, and abdominal discomfort may not appear until the tumor is large. Treatment is highly individualized. At specialized centers, multidisciplinary teams of surgeons, oncologists, and nutritionists collaborate to create personalized plans. These may involve surgery, chemotherapy, radiation, or newer approaches like targeted therapies, which are often explored in clinical trials. Finally, diabetes is directly linked to the pancreas's endocrine function. In type 1 diabetes, an autoimmune response destroys the insulin-producing beta cells. In type 2, the body develops insulin resistance, and beta cells eventually can't keep up with the high demand for insulin. The connections run deeper too. Chronic pancreatitis can damage beta cells, leading to a specific form of diabetes. Furthermore, a complex two-way relationship exists. Long-standing diabetes increases pancreatic cancer risk, while new-onset diabetes can sometimes be an early warning sign of an underlying tumor. Now, let's talk about how to nourish your pancreas through diet. For general pancreatic health, focus on lean proteins. Skinless poultry, fish, eggs, tofu, and legumes provide essential amino acids without excess fat. Colorful fruits and vegetables, rich in antioxidants that help combat inflammation. Healthy fats, avocado, nuts, seeds, and olive oil in moderation. Whole grains, oatmeal, brown rice, and whole wheat bread for sustained energy. For those with existing pancreatic conditions, small frequent meals, 5-6 per day, are often better tolerated than 3 large meals. Cooking methods matter too. Baking, grilling, or boiling is preferable to frying. To protect your pancreas, be mindful of high-fat and fried foods. These can overwork your pancreas and contribute to gallstones. Excess alcohol, a major risk factor for pancreatitis. Heavily processed foods and sweets, especially important to limit if you have diabetes risk factors, red meat and pork. These can be difficult to digest during pancreatic flare-ups. Beyond diet, these lifestyle practices significantly support pancreatic health. Maintain a healthy weight, reduces risk of gallstones and type 2 diabetes. Stay hydrated. Aim for 8 glasses of water daily, but drink between meals rather than with meals. Practice mindful eating. Chew thoroughly and eat slowly to aid digestion. Consider gentle exercises. Short walks, yoga, or stretching can help with circulation and stress management. Schedule regular checkups, especially important if you have a family history of pancreatic issues. 2 of the most important protections for your pancreas are: avoid smoking. Tobacco use significantly increases risk of pancreatic cancer and chronic pancreatitis. Limit alcohol. Heavy drinking is a leading cause of pancreatitis. The field of pancreatic medicine is advancing rapidly. Here are some exciting developments. Artificial intelligence in diagnosis. AI and machine learning are now helping doctors detect pancreatic lesions and cysts with greater precision on imaging tests like CT and MRI scans. Personalized cancer treatments. Patient-derived organoids, miniature lab-grown versions of tumors, are being used to test which treatments might work best for individual pancreatic cancer patients. High-risk screening programs. Specialized clinics now offer comprehensive screening for people with high risk of pancreatic cancer due to family history or genetic factors. Minimally invasive procedures. Advanced techniques allow surgeons to perform complex pancreatic operations with smaller incisions, leading to faster recovery. These innovations highlight the importance of seeking care at specialized centers that take a multidisciplinary approach to pancreatic diseases, bringing together experts from various fields for comprehensive care. As our journey concludes, we've uncovered the secrets of the pancreas. Though it's tucked away, hidden deep within your abdomen, its influence on your daily well-being is truly immense. This remarkable dual-function organ acts as both your body's master digester, breaking down food with powerful enzymes, and its precise blood sugar conductor, releasing hormones like insulin and glucagon. It works tirelessly and silently, a true unsung hero, to keep your body perfectly nourished and energized. Let's recap the simple yet powerful ways you can support this vital organ. First, nourish it from the inside out. Feed your pancreas with antioxidant-rich, colorful plants, lean proteins and healthy fats to reduce inflammation and provide essential nutrients. Second, adopt protective lifestyle habits. Maintaining a healthy weight and staying active improves insulin sensitivity, while avoiding smoking and excess alcohol dramatically lowers your risk of pancreatic damage. Third, listen to your body's signals. Don't ignore persistent abdominal pain, unexplained weight loss, or digestive changes. Early detection is crucial, so seeking prompt medical attention is key. And finally, stay hopeful. New research brings hope for better detection and treatment of pancreatic conditions. Your pancreas has been working for you every moment of your life. Now, you have the knowledge to return the favor. Small, consistent choices to support this vital organ can pay enormous dividends for your long-term health. Thank you for watching, and may you and your pancreas enjoy a long, healthy partnership.